transplant becoming more and more popular procedure, and I invited Dr. Tatiana Mamontova to ask some questions. Dr. Tatiana is an expert hair transplant surgeon. Tanya, how many years have you been working in this industry?
12 years now.
Oh, wow. So you have a great experience. So could you please tell us, over these 12 years, how do you see this industry have shaped and grown?
Yes, so it's growing very rapidly right now. Lots of multiple different clinics appearing and in a very close locations from each other, and they in a very big competition.
And does this mean that more and more patients want to have this procedure done?
Yes, I would say 100%, because the cost's getting lower since Wayne Rooney, the footballer, first made it. I think he paid around 30,000, but now it's dramatically dropped. So everybody can afford it, and there's lots of finance options as well on it.
Can you give us a little bit more insight on the cost? Because I would imagine that price range can vary, but what is a reasonable price and what price should be an alarm bell to the patient?
Yes, 100%. So with all the legislations that we have in the UK, to be able to proceed with procedures safely, we would have to pay for the CQC registrations, for GMC maintenance, the appraisals, all of that become a basic cost that you have to pay anyway, just the procedure to be happening. So I would say anything from 2,500 onwards, you should look at to start with. And then anything depends on the location. If it's London, could be £7,500. If it's Nottingham, could be £6,500. If it's more expensive or if it's less expensive, that's a really red flags for the patients to look out for.
And hair transplant traditionally has been a very popular procedure among men. But do you see that more and more women interested, and is it a good procedure for women to have?
Yes, we do see much more women coming to us on the last, I think, 3 to 4 years. We have almost 50-50 split, where before it was preliminary only male coming and doing procedure, which was the hairline and the middle and the crown and the beard. But I would say now it's more affordable, and the techniques that we're using, they are more elegant and like small, miniature, that's the word. We see more eyebrow restoration, eyelash restoration, and females hairlines, and transgender restoration hairlines as well. That it's very popular right now.
Well, amazing. That is all fascinating what you can do. And who would be ideal candidate for hair transplant? I know that detailed consultation is always must, but can you give us just a general guide?
Yes, of course. So simply speaking, we would look for somebody with the healthy skin and with absent hair on that particular area for any reasons, but without I would say diseases and disorders, something like autoimmune or something that can
affect hair growth.
Something that can affect hair growth on that particular area. So for example, if it's a female patient with the hair loss on the hairline, we can restore it. But if it's like a fibrotic alopecia, when the skin itself is affected, and if we will even plant the graft in there, it's not going to grow. So it's not going to be a permanent result. We would probably refer her to a dermatologist first.
Okay. And is there any way that patient can maximize result of their procedure? Is certain steps that they can take to, for example, prepare before the treatment and to take steps after initial recovery period?
Yes, 100%. So what we try to do is we try to tailor for every single patient like a private tailored treatment plan. It's not consist only from the surgical procedure, it consists from non-surgical methods that can enhance the hair itself, enhance the pre-existing hair on that area, and also restore blood supply into the tissue and nutrients into the tissue. It's so much more you can do. And you can do derma rollers with different vitamins, nanosomes. You can do an exosome treatment and injections, PRP, so much more. So I would advise for anyone who's interested, just get in touch with our team and we would give you the treatment plan to choose from.
And I think these days, very often people want to have a quick fix. So would you say, in your experience as a surgeon, the patient who takes this preparation to do extra steps, like maybe nourish their skin with the right vitamins, do the PRP, exosome treatment, maybe take some required supplementation, improve lifestyle, diet, does it really make a difference in comparison to those who just, I want this surgery and I don't want to worry about anything else?
It makes a huge difference. It makes a huge difference for the patients who are approaching to the problem with a complex method of solutions. If you want a quick fix, unfortunately, even if you do hair transplant on that particular area, if anything goes wrong, then you're not going to have a permanent result. For example, you're deficient on iron or you're deficient on zinc and you don't know about it, then your hair will just simply thin and they will fall off.
In terms of the longevity of the procedure, how long patient can expect result of hair transplant surgery to last and how soon they need to repeat it if they do?
So if we do hair transplant, we are using hairs from the specific areas at the back and sides of the head, which we called a permanent zone or a donor area. So if we take hairs from that area and transplant anywhere you would like, if it's a beard or if it's the eyebrows or lashes or the hairline, it stays there forever. So it stays there permanently until there will be some factors that will maybe affect the skin itself and then may affect the hair. That's why it's so important to look after not just your hair transplant, to look after your pre-existing hair and areas around it and health in general.
It sounds to me that sometimes hair transplant surgery could be a good motivation to improve your wellness. Because if you invested in this procedure, which is, yes, it's affordable, but it's still investment, I think it just makes sense to maintain it with doing little routines to make it last and to achieve better results.
I totally agree. We do see so many patients who uses a surgery itself like a trampoline to better life, better lifestyle. They go to gym straight away, they book their holidays, they maybe go from bad relationships to better relationships.
Amazing.
Yeah, it's like a life-changing.
And what is your opinion on health tourism? Because that is directly related to hair transplant. And I know so many people that has been abroad, for example, for some surgical, dental work, and some patients who go for hair transplants. So what is an expert, your opinion on that?
I would always advise people to stay safe. If you know where you're going and you know the doctors personally maybe, or if someone's been there already and they have all accredited to perform the safety procedures, then it's absolutely fine. But always remember, if something will goes wrong and you just came back from, let's say, Turkey or any other countries, your insurance wouldn't see it as a healthcare. Your insurance would see it as a cosmetic procedure. So there will be no coverage within it. We had a terrific case, I think it was 2014, when one of our patients came back. I'm not going to say what country was it. And in a couple of months, he felt unwell and he discovered that he got hepatitis C, which was absolutely terrible. And the NHS refused to treat him because it was a cosmetic procedure that he went for. And he still doing his, bless him, a recovery from it.
Wow. I have had in my dental practice some also terrible cases where patient went for implant dental surgery abroad, and sadly implant has been placed into their sinus and they needed to have a full max fax surgery here. But luckily at the time NHS provided the care because it was basically an emergency situation. I think you need to think twice before taking these risks.
Yeah, I agree, totally agree. Safety is important. Just think, if something happens and your doctor is nearby, it's always better if something happens and your doctor somewhere else, like abroad, far away.
Well, I think it's also finding who will help you here, who
Yeah.
will find the answer to this solution. Another question. Sometimes patients take a prescriptive medication
Yep.
before or after hair transplant. Is there is any side effects if you take them long term, and how long is it advisable and safe to do so?
Yeah, it's a very good question. Look, even if you take paracetamol, there is always on the leaflet a massive amount of side effects.
Paracetamol probably has the most of them.
Probably. It's really long one. So what I would always advise, if you've been prescribed with finasteride or minoxidil oral or maybe some antibiotics, some people love to prescribe prednisolone after treatment or anything else. If it's anything with prescription, then you need to notify your GP that that's what you were planning to take. And make sure you double check with your doctor. Is it any maybe liver function you have to do? Is it depends on the course of what you need to take. If it's finasteride, there's more longevity within it. If it's just a short course of antibiotics, maybe you need some probiotics with it. Just always double check and ask as much questions as possible of your doctor.
And also, would you tell us a little bit of the procedure itself? Like, how long does it take and what is the recovery time? Because patient who might planning or just intrigued would want to know what is actually involved, what's happening behind the doors in the hair transplant surgery.
Yeah, that's a good question. So I would take an example of, let's say, an eyebrow transplantation. So if you an eyebrow transplant patient, then we would greet you, let's say 9 a.m. o'clock in the morning in the clinic. We would do all the paperwork, all the consultation, all the procedure questions that may be outstanding after the first consultation. You can also come with your friends or relatives just to make sure you feel okay. We will do design, and if you're happy, then we will proceed. The procedure itself takes about 2, maybe 2.5 hours to extract, and maybe 2.5 hours to implant. In between, we do a lot of different breaks, just make sure the patient is comfortable. And then at the very end, we'll always give a mirror, just double check and triple check. And if you're happy, we discharge you on the same day. So I would say everything in total, maybe 6 to 7 hours, but it sounds a lot, but it's a very comfortable day to go through.
And how long is the recovery afterwards?
Yes, sure. So I would say if it's eyebrows, it would be maybe 10 days to 2 weeks. And if it's the big hair transplant, like a middle and a crown and the hairline involved, or big beard, I would say maybe 2.5 to 3 weeks.
And does it mean that you need to take this time off work, or is it just you need to take some precaution? Basically, would you look bruised? Would you have black eyes? What visual side effects of that?
Yes, of course. So swelling and bruising, it's something that goes along with every single surgical intervention. But we always say take 10 days up to 2 weeks off work, regardless of what you do, regardless of the profession that you do. But then if you can have a little bit extra, just maybe take that too. So for example, a couple of more days extra on it. Depends on how you're healing, because everybody's different and the age is different, everybody's healing differently. In the winter, people heal quicker. In the summer, when it's sweaty and hot, people take a little bit more extra time. So I would say the golden standard is 2 weeks off, and then after that, see what happens.
Well, I think you shared so much valuable information.
Thank you.
And I think patients who watch this video most likely have everything set up and have been fully informed how to find the right clinics, the right surgeon. So just make sure you stay safe and do your research.
Yeah.
Thank you very much, Tanya.
Thank you so much for having me.